In this video, I would like to go over the clinical application of different selective estrogen receptor modulators that I've listed here, go over their adverse reactions, and then after that briefly discuss the medical treatment options that are available for infertility as well as for abortion. So Clomiphene is a fertility agent that acts as a partial estrogen agonist in the hypothalamus, and so it will enhance the FSH and LH release, which will cause ovulation. And then the side effect of the Clomiphene includes multiple births. Tamoxifen, on the other hand, can be used for the treatment of osteoporosis as well as for the treatment of breast cancer. And the way it works is that tamoxifen acts as an estrogen antagonist in the breast, and so it will prevent breast cancer, while it acts as an estrogen agonist inside the bones, so it will prevent osteoporosis. And then one important side effect of tamoxifen is endometrial carcinoma, and the reason for that is that tamoxifen also acts as a partial estrogen agonist in the endometrium, and so it increases the risk of endometrial carcinoma. Other side effects include, for instance, hot flashes as well as thromboembolism. And then Raloxifene, similar to tamoxifen, can be used for the treatment of osteoporosis as well as for breast cancer through the same mechanism that I just discussed. And then side effects of Raloxifene also include hot flashes as well as thromboembolism, but no risk of endometrial carcinoma, unlike tamoxifen. So here the memory aid that I have for you to remember that the Clomiphene, tamoxifen, and Raloxifene, their features is that Phen is what is at the end of all of these drugs. So Phenex is a female, so these medications are estrogen receptor modulators, which is fertile, so Phenex can lay many eggs. So Clomiphene is used for inducing fertility. And then Phenex has strong bones, never develop osteoporosis, which is a feature of Raloxifene that is used to prevent osteoporosis. And then Phenex doesn't have any breasts, so it cannot develop breast cancer. So tamoxifen is used for the treatment of breast cancer. On the other hand, the side effects of all these serum medications is hot flashes. So Phenex is so hot, we all know that Phenex is a firebird, so it's so hot that blood clots are formed inside her vessels. So thromboembolism is the another side effects of all these serum medications. And then with tamoxifen, you should also know that there is an increased risk of endometrial carcinoma. Alright, now the treatment options that are available for infertility include the Clomiphene, which we just discussed. And Clomiphene is a selective estrogen receptor modulator that will act on the hypothalamus, increase LH and FSH, and so it will induce ovulation. But note that Clomiphene must be used in patients that have normal estrogen production. And so if there is a patient that has low estrogen levels, then you will have to treat them with the human menopausal gonadotropin, which is a mix of LH and FSH. And then if medical therapy fails, then you can proceed with the in vitro fertilization. As for the medical abortion, you can treat these patients with mifepristone. The other name for it is RU486, which is a competitive inhibitor of progestin at the progesterone receptors. And so RU486 is usually combined with the misoprostol, which is a prostaglandin E1, to help terminate the pregnancy in the first trimester. And then the side effects of RU486 include, for instance, vaginal bleeding, abdominal cramps, and nausea and vomiting. And then one final medication is methotrexate, which is used for the medical abortion in patients with ectopic pregnancy. And that concludes our discussion.